We think we've seen well over 10,000 seizures. I am an expert in Raylan's seizures. I'm here with Amber, my oldest, and I want you to hear her answer on this. Do you think I know more about seizures than Raylan's doctors? And know that I've seen thousands of seizures. I've probably seen more seizures than all of her doctors, including her neurologists.
Yeah, I think that you know more about Raylan's seizures than the doctors, but in general, like, they went to school and literally studied seizures,
So they're the experts in seizures.
I mean, yes, generally seizures.
Isn't she smart? Okay, I am going to show you some footage. This is me holding Raylan's hand right after she got over a pretty nasty seizure. So she held her breath and her skin got all gray. She was on the pulse ox, but I don't know what it would have said because she yanked her thumb out of the pulse ox when she first started having her seizure. Probably the pulse ox would have said it was into the 70s. I'm not sure what that really means. I mean, I know what the pulse ox means, but the lower the number is, I know the less accurate it is. So I don't know what her oxygen really is. I just know it goes low, but I also know it always comes back up. We don't worry about an oxygen tank when she's having a seizure. We worry about her not breaking limbs because of, if there's something hard next to her, and we worry about her choking. So if we can, we turn her to her side. I got the pulse ox back on her when she slowed down a little bit, and then it was going off because her heart rate was too high, but it's not dangerously high, and I could watch as her heart rate went down. It kind of helped me know seizure was over too, although she's not usually hooked up to a pulse ox. Anyways, my husband did the math a while ago, and between him and myself, we think we've seen well over 10,000 seizures. I'm pretty confident that is more seizures than most neurologists have seen, because we have lived for the last 8 years with someone who has multiple seizures a day for the last 8 years, and we're always with her. So you might think when it comes time to learn about seizures in nursing school that I'm an expert already, that it'll be a super easy unit for me, that if I get to do clinicals on a neurology floor, that I'll just be super confident and comfortable with all the patients, and that would definitely be wrong. I probably do have an advantage in the nursing exam on seizures. We've had home health nurses come to our home and they didn't know what a VNS was. I'm pretty sure that would get covered in the seizures unit, but it's just a little fact you're not going to remember if you're not working with seizure patients. I know a little bit about if you fail so many seizure meds, the likelihood of another one working is small. I know about the ketogenic diet. So I know some stuff that will make the exam, if there's an exam on seizures, it will be easier for me. But that makes me far, far, far from an expert in seizures. For example, if one of my other children were to start having a seizure, I would freak out. I would get the phone, I would call 911, I'd be yelling at someone else, hey, bring Raylan's Klonopin and Diastat over, but I wouldn't give it to them. I'd be asking 911, can you find out what I should give them? Can you ask, or, when the EMT came, can we give her this or him this? I wouldn't know. I don't know after someone has their first seizure what the likelihood of another seizure is. I don't know what protocol is. Like, if the seizure stops, do the EMTs still take them to the hospital with the ambulance on? Do we drive them to the hospital? Do we just go to bed for the night and stay at home and set up an appointment with neurology whenever they can see us? I don't know what any of that protocol is. I am an expert in Raylan's seizures. Here's another reason I know that I'm an expert in Raylan's seizures. Because when we are at the hospital, the doctors who are experts in seizures come in the room and ask me a million questions about Raylan's seizures.
How long do they normally last?
If she's having a seizure, they keep looking at me and say,
Is this normal? Is this normal? Does she normally turn gray like this? Do you normally get oxygen? Does this look normal? Do you think she's finished with the seizure yet?
Like, they ask me if I think her seizure is over. they're not asking it to see if I'm a competent parent. They're asking because they know I'm an expert in Raylan, and that my information from seeing thousands of her seizures can help them know how to better treat her. We don't give Diastat if the seizure hasn't gone away in 5 minutes, unless it's still really intense. Even though her oxygen pulse ox, would be going off because her face is gray and her oxygen's dropping, we don't grab a tank of oxygen and put it on her because we know it is gonna come right back up. It always does. Someone told me that they were told in nursing school you needed to get an IV on a patient as soon as possible if they were having a seizure. And I just thought, I don't know. Like, I don't even know how you would do that. Maybe if they were having an absent seizure that wasn't stopping, they would, but everyone's unique. So I know I'm the expert on Raylan because the doctors don't ask me all those questions to see if I'm a competent parent. They ask me all those questions so they can be competent in Raylan's seizures. So they can take their expert doctor seizure knowledge that I don't have and my expert knowledge about Raylan's seizures and put it together and find the best way to treat her. And I've learned that the best doctors will know to consult you and respect you and listen to you. And I think, they have to judge, and that's a hard thing. How much does this patient or the caregiver of the patient know? Because sometimes they don't really need to consult me at all. Sometimes they don't need to ask me any questions hardly, besides a little bit of history. If Corey were to need surgery, well, he did need surgery. He had an eye surgery. They didn't ask me, I don't think, any questions about Corey's vision or even those eye surgery. They didn't ask me any questions about, his health other than,
is he on any meds? Does he have asthma?
you know.
Has he been healthy the last couple weeks?
And then they just put him under and did eye surgery. And they didn't ask me anything else. And I think that was appropriate. I don't think doctors always need to ask us a million questions, but there's times when they need to consult the expert and the patient, which is either the patient or the patient's caregiver. So last video, I showed you guys some messages that I was sending to Raylan's gynecologist, and I was talking to you about how sometimes I have to advocate for Raylan and I have to speak up and tell a doctor, hey, I think you need to know this about Raylan. And nurses have to do that too for their patients. They spend more time with the patients than the doctors when you're in a hospital. Sometimes nurses learn something about a patient that the doctor's not going to see, and the nurse has to advocate for the patient. Say, I think you need to know this about your patient. I was a little nervous about it because I've only met that doctor one time, and I didn't know how good of a team player she was, and she doesn't know me hardly at all, and I didn't want her to feel like I was insulting her intelligence or being bossy or coming across as just rude or demanding, or like I don't think she knows how to treat her patients, because none of that was the case. So you can look in the previous video of how I tried to tell her, hey, we don't want Raylan to have this procedure at the same time she's going under sedation for this other big procedure, because what she wanted to do was gonna make the hospital room more germy. I mean, that's just what happens. And I know this just because the amount of infections Raylan's had, but Raylan has this history of infections, really bad bugs that she's got after bony surgery. And we know we need to do everything we can to keep that hospital room as sterile as we can for her surgeries. And I've been told by previous doctors, oh, no, we can't brush her teeth right before this surgery because this is a bony surgery. And we don't do other procedures during bony surgeries if we can avoid it. So I knew all this stuff, and I knew Raylan's history of seizures or infections. I knew Raylan's history of infections from bony surgeries. And I was like, it's not a good idea to do this procedure, I don't think, during a bony hip surgery if it can be avoided. So I sent her an email or a MyChart message, not knowing how she would respond, and she's a great doctor. She's a team player. So here's all the experts Raylan's gynecologist consulted to decide what was the best treatment for her. She knows about Raylan's female issues, but she knows that radiology knows the best way to get good imaging of Raylan. And she knew that Ortho knew information she needed to know on, could we do an MRI on Raylan with all the metal in her spine from a spinal fusion. And she knew, I told her Raylan has a VNS, so she knew she had to consult neurology and check with them and Raylan's brand of VNS. And then she actually checked with the maker of the VNS to see, can Raylan have an MRI with that? Because the spinal fusion metal was okay, but turns out she couldn't have an MRI. But the team player, gynecologist doctor, knew to consult ortho and neurology, and then the maker of one of the products in Raylan. And then when I messaged her, I said, I don't know if you've consulted infectious disease, but here's Raylan's history, and here's why we're really uncomfortable with doing other procedures when she's having this big hip surgery. And she consulted infectious disease, and she listened to me, and she scheduled something for this week. And I don't think she was insulted. I think she talked to all the experts so that she could do her job the best way possible. So that's what it is. You have information for doctors maybe that they don't have if you don't give it to them, that they need. If you're going to nursing school and you're going to be a nurse, I feel like I've got some experience in this. Sometimes you have information you have to tell the doctors, but there's polite ways to do it and there's non-polite ways to do it. And some doctors are team players, like this doctor she's seeing Thursday, and some doctors aren't. Most of the doctors that we've met with Raylan, most of them have been team players. It's been great. The one that isn't that I can think of is an amazing surgeon. And so we still see him, but it's frustrating. And I think it has hurt the quality of her care that he's not as much of a team player, that he doesn't realize sometimes that we're experts in Raylan, and some of the information we have about Raylan's history might be really important to treatment. So that's a complaining tangent. I don't want to go focusing on that. I just want to focus on good doctors know what they're experts in. They know what you're an expert in as the patient or caregiver. I think good doctors get to know nurses, and they know which nurses probably that they can trust. And good nurses know how to get information on their patient and filter what needs to go to the doctor. And how do I tell the doctor this information? Not in a, you need to do this for your client, but it's important you know this about the client I just learned. So does that change the med you want to give, or does that change anything? You know, that kind of stuff. So I've rambled on that. Do I know more than doctors? I know more than doctors about Raylan, but no, I don't know more than doctors. That's why we go see doctors. And I'm super thankful for her doctors. Young doctors, you know I'm old because I sometimes, oh my goodness, this little doctor, I'm like, oh my goodness, he's a kid. He looks 17 to me. No, you know you've hit middle age when you start looking at, he's a doctor, he's a resident at least. Anyways, young doctors, less experienced doctors, they're often experts. They're often the quickest to be team players. They're often the most open to learning about the latest research, the latest treatment options. So that's a totally side topic, but I definitely think that often young doctors are some of the best experts. So, you know, you can be an expert in different things. Part of it's your degree, part of it's your willingness to be a team player. Part of it is, you know, knowing what teams to consult with when making decisions for the medical stuff you're in charge of. I rambled. That's that. So what are you an expert in?